we're going to get started to look back at our 2024 year in review. As that gets pulled up, you will see on the very first slide that we have a picture of some students, part of our initiative, collectively carrying what is, I think, something for the garden that they're building. I'm blanking on the word now. And I think it captures so well, and the reason I wanted that picture used, it captures the collective effort of Bronx Health REACH, because we are first and foremost a community coalition. That's how the work has been done. That's how the vision has come about. That is what has sustained us and pushed us along for the 25 years. So the community has always been at the heart of Bronx Health REACH, is at the heart of the CDC REACH effort, even though sometimes we have to remind them occasionally. But we never need to be reminded at Bronx Health REACH. Also on that front page, you will see some policy efforts that we have been involved in over the last year, this last year, or 2024 year. Way before CDC asked their REACH grantees and others to have a focus on policy, system, and environmental change, the Bronx Health REACH Coalition, through the very organic process that we have used for our evolution and development, have realized and recognized that any change that will be impactful on the deepest level has to involve policy changes, policy efforts. And so those images capture what's at the heart of Bronx Health REACH, the collective work of community folks coming together and working, and the recognition and the push to have the kind of policies that will lead to a healthier Bronx residents, and ultimately the realization of health, racial and ethnic health equity, and the elimination of racial and ethnic health disparities. And so with that, let's get started. First up, we are going to have Kelly and Dana talk about the Healthy Pantry Initiative. And then folks, you will continue as you come to your particular part of our year in review, staff, that is. Okay. Kelly and Dana.
Thank you so much, Charmaine. Good morning, everyone. Happy Friday. So yeah, I'm going to start talking about our Healthy Pantry Initiative. So through the work in Bronx Health REACH, our Healthy Pantry Initiative trains food pantries on implementing the federal food service guidelines, including the procurement of healthier food and creating a healthier environment. We work with our consultant, Gerald Owens, who provided training and technical assistance to our 4 food pantry partners: Bible Church of Christ, Every Day's a Miracle, Manna of Life Ministries, and Thorpe Family Residence Nazareth Housing, to implement Healthy Pantry Initiative strategies that increase access to healthier foods. The partner sites conducted client surveys, gathering more information about culturally preferred foods they would welcome into their community. And we have some pictures here of Bible Church of Christ and their food service guidelines work that they've done, and the fresh produce that they provided to their community through their food pantry. We also, if we can go to the next slide, please. See the same thing with Every Day's a Miracle, and their setting was in a school, and the fresh produce that they also provide and the teamwork that helps do so. Next slide, please. Manna of Life Ministries did more of a tabletop distribution, and also has like a garden associated with it to provide the fresh produce. Next slide, please. And then Thorpe Family Residence, Nazareth Housing, and also their food pantry and the great work that they do as well. So all of these pantries worked within the settings that they have and kind of adapted to that as well, all in the effort of providing healthier foods, which is great. I'm also going to talk about, next slide, please. Awesome. So then what we also did is Bronx Health REACH partnered with Gerald Owens and created a series of Healthy Pantry Initiative training videos. And this was created to promote healthy food choices and cultural food preferences for our food pantry partners. Yeah, next slide, please. This is an image of just like the food service guidelines and packaged snack checklists to ensure that they're healthier. Next slide. So then,
Dan,
yeah.
I think we can go back one slide.
Oh yeah, so pass it on to Kelly.
All right, thanks. So Bronx Health REACH also partnered with the CUNY Urban Food Policy Institute to assess the quality of the foods in the 3 cafes at the Lehman College campus. And by using the New York City food standards and the food service guidelines for federal facilities, Lehman determined the need to remove fried foods from their cafeteria menu, offer non-fat and unsweetened dairy options, provided more fruits and vegetables and plant-based proteins to the 1,750 students who use the cafes. In year 2, Lehman will gather student feedback on what type of healthy options they would like to see on the menu, as well as work with a food vendor to replace the current menu items with healthier alternatives.
Yes, and then if we could just go one slide prior to that, in addition to the food service guidelines, I did mention about the Healthy Pantry Initiative training videos that we did, and we just also wanted to share a clip. So because of this as well, which I believe we can do so now.
Michael, just make sure your audio is checked for this. Michael, I don't hear any audio. I don't think you have the audio checked on your sharing. Great. Thank you.
Let's talk about culturally preferred foods. Food pantries serve customers from a variety of backgrounds. Culture can be defined by group membership, such as racial, ethnic, linguistic, or geographic group, or as a collection of beliefs, values, customs, ways of thinking, communication, and behaving to a specific group. This section is designed to help food pantries serve their communities in a manner that meets their cultural and dietary needs. The following methods can help food pantries better understand the background of their clients: surveys, informal interviews, focus groups, and observation. Develop a plan for incorporating culturally preferred foods into your food service guidelines. Collect feedback from staff and clients. Gather socio-demographic characteristics of clients. Socio-demographics include age, education, religion, employment, marital status, income levels, race, ethnicity, and migration background. Collect information that will identify key facilitators and barriers to offering culturally preferred food options. Define the goal of your assessment before determining survey questions. Make sure they lead to attaining your goal. Questions can be scaled, multiple choice, open-ended, can be done with pen and paper, digitally, or verbally. Focus groups gather clients from diverse cultures to participate in a guided discussion about a particular topic. The responses can be used to inform offerings at the food pantries. Food pantry staff can determine customer preference through observation. For example, a food pantry using client choice model can see which foods clients choose most often. Those foods should be given preference when ordering and seeking donations. While there is variety in food preferences from culture to culture, there are also commonalities. Here are some commonalities to consider when providing culturally preferred food options. Offer fresh food over processed food whenever possible. Provide a variety of fresh food options. Rice and beans are staples in most cultures. Offer culturally preferred herbs, spices, and cooking oils. Here are some examples of foods that are common across cultures: rice, beans, onions, garlic, tomatoes, oil, potatoes, flour, lentils, and fish. Here are some tips for sourcing culturally preferred foods. Request specific items in food drives. Use vendors that offer international food options. Source fresh produce, whole grain breads, meats, seafood, and dairy. Don't be afraid to start with only a few cultural food options. Source culturally preferred herbs and spices. Here are some popular holidays to consider when sourcing culturally preferred foods: Christmas, Easter, Ramadan, Diwali, Passover, Lent, Dia de los Muertos, and Carnival.
Right, thank you so much, Ima, for playing that. That was just a snippet of the Healthy Pantry Initiative training videos that was created. And in addition to that, we also created a Healthy Pantry work group that was formed this year in 2024 and comprised of New York City emergency food organizations in New York City. And the purpose of the work group is to advocate with elected officials for healthier foods at local food pantries. Okay. And I'm going to pass it on to Ima.
Good morning, everybody. So I will be speaking to you today in regards to our Health Bucks and Farmers Market promotions and our Health Bucks efforts. So we have 11 sites that participated in the Health Bucks Best Practices Training and received Health Bucks coupons. They distributed 5,900 Health Bucks coupons with an average redemption rate of 83.14%. Our partners were able to complete and lead 27 farmers market tours with 270 participants and promoted an average of 4 farmers markets, in which 42 participants were the first time Health Bucks coupons recipients. Also, Urban Health Plan provided 6,000 Health Bucks coupons to Bronx Health REACH, which we distributed to our partners in the 17th district. These were funded and provided by Council Member Rafael Salamanca Jr., and 5 sites were recipients of these Health Bucks. I will show you some pictures of our partners that participated in our Health Bucks initiative.
And yes, and now we move on to the Food as Medicine Produce Prescription Program. So the Food as Medicine Produce Prescription Program, in collaboration with Corbin Hill Food Project, continues across 3 institutes for family health centers, including Urban Horizons, Stevenson, and Walton Family Health Center. This year, there were a total of 69 distributions with 53 unique participants, picking up 2,346 shares. Corbin Hill hosted 28 food demonstrations across the 3 sites, and the food demos highlighted the healthy and easy ways to prepare the various produce offered in these food shares. The nutrition skills share It's something that Corbin Hill hosted, and that it was led by the community chefs and nutrition educators that taught participants to prepare a healthy recipe and learn culinary skills. Around 50 participants attended, and this occurred in September, where also they had 15 patient satisfaction surveys completed throughout the three food as medicine sites. And the results of the survey were that they showed that there was high participant satisfaction. Next slide.
So Bronx Health REACH received funding from the New York Health Foundation to pilot a healthy bodega initiative in Hunts Point in partnership with the Bodega and Small Business Group, Collective Fair, and several other community-based organizations. 8 to 9 bodegas will participate in selling healthy grab-and-go items for purchase. This will test a group purchasing business model that will allow for prices that are affordable for their consumers. Next slide. And this year, the New York City Good Food Purchasing Program Coalition worked to pass the Good Food New York bill. This bill is based on the values of the Good Food Purchasing Program, which aims to help public institutions buy food in a way that supports 5 key goals: strengthen local economies, improve animal welfare, environmental sustainability, good nutrition, and fair treatment of workers. The bill is now awaiting signature by the governor. And the coalition is now working on a bill to amend the General Municipal Law 103 to permit municipalities to consider whether business practices support local economies, environmental sustainability, worker well-being, nutrition, animal welfare, racial equity, and supplier transparency, while also offering preference to minority and women-owned businesses instead of the current law, which considers only the lowest responsible bidder in making purchasing decisions. Michelle Hinchy and the Assembly Major Leader Crystal Peoples-Stokes introduced this bill, S6955 and A7264. Next slide. And Bronx Health REACH endorsed Intro 641, a New York City Council bill, which would require that at least 2 meals on restaurant children's menus meet certain nutrition standards. Several Bronx Health REACH partners provided testimony during a New York City Council Health Committee meeting on December 2nd, including BronxWorks, Shinake Sean Butler, and Teens for Food Justice. Pass it back to Kenny.
Yes, in regards to the breastfeeding initiative, Bronx Health REACH partnered with Morris Senior WIC to host free monthly lactation discussion sessions for people working in maternal and child health care that are interested in advancing their career in lactation promotion, protection, and support. MWIC hosted 8 of these sessions, and 71 individuals received credits towards their continuing education. Some of the topics included physiologic parenting, breastfeeding, best sharing and breastfeeding, and caring language and lactation care for LGBTQIA+ family and community members. In regards to community of care, the 10 steps to becoming a breastfeeding friendly hospital referral to Baby Cafe initiative. Marcenia Wick engaged with the breastfeeding coordinators and lactation consultants at Bronx-based hospitals to solidify collaboration and enhance referrals to baby cafes. 50 individuals were referred to the Baby Cafe by New York Presbyterian, Bronx Care, Lincoln Hospital, Albert Einstein, Jacobi, and Montefiore. MWIC hopes to enhance these efforts in order to increase referrals to baby cafes and other resources that benefit new mothers and their babies. In June, Morrisania WIC hosted a variety of activities for National Breastfeeding Month and Black Breastfeeding Week, including African Mothers Breastfeeding Fashion Show. 27 breastfeeding moms, along with their families and children, showcased the beauty of Africa by wearing traditional clothing and sharing African customs. This year, Morrisania WIC hosted 30 baby cafes attended by 176 breastfeeding mothers. Breastfeeding trainings were also done, and these were held at Mark Academy, Institute for Family Health, and at Sienna House. Next slide.
Yes, hi, this is Mariah Burns-Olive. We ran Sorry, can you hear me?
You're good. I
Oh, you
can
can
hear
hear me. Okay. Okay, so the doula vaccine education initiative took place this year. We reached Bronx Health REACH reached 6 doulas. 6 doulas were trained by Bronx Rebirth and Progress Collective, and the 6 doulas completed surveys on how to educate pregnant and breastfeeding women about vaccines. Next slide.
Next slide, please. So Bronx River Alliance, Bronx Health REACH partnered with Bronx River Alliance to advocate for East Tremont and East 177th Street missing link safety improvement in order to create safer entry to the Bronx River Greenway from this location. They collected 263 signatures advocating for the safety improvements, which exceeded their original goal of 125 signatures. Safety improvements that were implemented include crosswalks were painted and signage was added at busy intersections at the bus depot and Boston Road, Tremont, West Farms Road intersection. Bronx River Alliance also hosted engagement events to promote and develop Friends of Starlight Park. The Bronx River Open House at Starlight Park kicked off the program season in April and brought over 1,000 community members to Starlight Park. Other events included the Cross Bronx Paddle, Starlight Festival, Summer Community Paddles, and Climate Week Walk. Next slide. And Transportation Alternatives, another one of our partners, is coordinating with the New York City Department of Transportation on improvements to the intersection of Boston Road and Allerton Avenue, since there has been an increase in traffic incidents there. And Transportation Alternatives has also completed walk audits and made recommendations to the New York City Department of Transportation for improvement of the Grand Concourse Phase 5. Some of these include improving bike lane markings, bollers for raised bike lanes, raised crosswalks and speed bumps at points where there are exits between main and service roadways, and improvements to bus service. I'll pass it to Ima now.
Our Complete Streets project, in collaboration with Equity Design, Bronx Works, Greater Faith Cathedral, Bible Church Christ, and Christian Bible Temple, completed the Active Community Tool, the ACT assessment, a walk audit, and held a number of town hall meetings to identify Complete Streets redesign projects that will lead to more pedestrian-friendly routes and increase physical activities. So there were the 4 sites were able to identify areas to work on. Bronx Works identified the Fordham University and Morris Heights neighborhood, zip code 10453, Christian Bible Temple, Parker Street to Westchester Avenue, 10462, Greater Faith Cathedral, Wakefield, 10466, Bible Christ Church, 169th Street between Morris Avenue and College Avenue. In this picture, you will see Christian Bible Temple's walking group identify the sanitation issue along with their walking route, and that made it less appealing. The group went along the walking route and picked up trash.
Yeah, and then, hi everyone. We're now going to talk about some of the open street works that we've been doing with our schools in the Bronx, starting with PS18. PS18, along with Bronx Health REACH, Equity Design, Street Lab. We helped them host 7 open street programs, and they held their 2nd annual Bike Fest with the help of Major Taylor, which is a cycling club whose mission is to promote health by supporting recreational and social cycling activities in the community, as well as U.S. cycling. And they also participated in Harlem Crit. Here we have some pictures of PS18. Top left, you see a group of students who had received some medals, along with Major Taylor and U.S. Cycling, and they brought in actually an Olympian, a cycling Olympian, into their Bike Fest. And the next slide, please. At PS32, their main goal is to become a fitness hub for their community. So with the help, once again, of Bronx Health REACH, Street Lab, and Equity Design. They were able to host 10 open street programs, and they've expanded that not only for after-school purposes, but they've used their open streets during school hours for outdoor learning as well. And in this picture, we see the teachers, you know, they have the little tables set up that Street Lab helped provide, as well as doing other art project activities outside. They utilize the open street for their Climate Action Day event, in which kids used scraps from art projects that they've done inside, repurpose them for other projects as well. Next slide, please. One of our newer schools to start doing their open street was PSMS 5. And they actually hosted 7 open street programs with the purpose of utilizing the space for recess. Next slide, please. And another very new school to the Bronx Health REACH work is PS19, which is a new school partner that hosted 2 open street events this year as well. Next slide, please. Yes, and an exciting project that we accomplished in 2024 was the CS 300 School Garden, which was a project funded by the New York State Division of Criminal Justice Service. And I am going to touch upon this later on during our partner spotlight. Yep. Next slide, please. Yep. Pass it to.
Yes, so Boogie on the Boulevard. So 2024 marked the return of Boogie on the Boulevard as a live in-person event since COVID paused the fund. This year was the first year that Boogie on the Boulevard was officially part of New York City's DOT's Summer Streets program. Around 21 organizations participated in immersing the public in fitness programs, art, music, and more. It was great seeing the community come together and even create a dance party full of smiles and movement. And we just also want to say that funding for this event was provided through the New York City DOT Summer Streets program. Next slide.
And in partnership with Bronx Health REACH and Cornell University Cooperative Extension, New York City, Mark Academy and Family Center completed providing nutrition and physical activity training and technical assistance to 15 home-based childcare providers who all made progress in adopting nutrition and physical activity practices and policies. Mark Academy has also recruited and has been providing training to a new cohort of 16 home-based childcare providers. Next slide. Pass it to Mariah.
Mariah.
Yeah, I'm here. Hold on. So Bronx Health REACH's vaccine promotional efforts were covered by 3 grants this year: CDC's REACH and National Institute for Health and NYCL, which is New York Community Engagement Alliance to End COVID-19 Disparities, and U.S. Health and Human Resources expanding COVID vaccination program. Former Bronx Health REACH vaccine partners opened their doors and hearts to host tabling, presentations, and vaccination events to encourage community members to get vaccinated. Bronx Health REACH hosted 15 vaccine events where 240 flu vaccinations and 161 COVID vaccinations were given. We distributed 13,960 handouts, gave 26 presentations to 1,028 people, hosted 8 partner training events for 79 people, and collected 22 pre-post surveys about Bronx residents' knowledge, attitudes, and practices around COVID, flu, and RSV. Next slide. I think you're going to the NIH. NYCL, New York SEAL funding, New York SEAL funding was made possible for Bronx Health REACH to provide 132 COVID vaccinations, host 3 partner trainings, for 23 people and provide 12 presentations for 555 people and collect 60 surveys. We also offered the HRSA, the Human Health and Human Resources program mentioned earlier. That funding ended in 2024. During the time of the program, we hosted 112 events with 24 partners, reaching 1,862 people. We distributed 4,668 handouts and gave 74 presentations, reaching 1,632 people, as well as hosting 3 partner trainings events for 39 people. In the past year, Bronx Health REACH gave many specialized presentations as well. We talked about kidney disease and COVID-19 flu, which was presented by the National Kidney Disease of Michigan. We hosted a talk about COVID-19 flu and lung disease with the Institute for Family Health's Dr. Eugene Schiff. And we had talks on diabetes and COVID-19 and flu with Christine McGow, a registered dietitian with Stop and Shop. We thank our 24 community partners for their participation in the past year. Next slide.
Hi all, I'll be giving an overview of our health disparity work group efforts. The health disparity work group was joined by Aldrin Bonilla and Cesar Ventura from the Fund for the City of New York to do an in-depth review of the True Cost of Living 2023 report. The group narrowed down specific areas for advocacy, like the area median income. The health disparity work group created an outreach campaign designated April as Not 62 Month, and health disparity work group members, Pastor Wendy Kelly Carter, Pastor David Powers, Sandra Jenkins, and Bronx Health REACH Director Charmaine Ruddick, appeared on the BronxNet show Stay Alive with Church Alive, hosted by Bishop Timothy Burkett, which is depicted in the top picture of the slide. Michael Stevenson, co-director of County Health Rankings and Roadmaps, joined us to review the changes to the 2024 County Health Rankings. In the fall, we had another conversation with the CHR and our team on what the shift away from rankings means to us and what the alternatives are. Catherine Robertson Miranda, assistant professor at Fordham University, joined us to answer some questions and review our health asks. In July, the work group had conversations on how our faith-based outreach initiative efforts and health disparity work group asks can intersect, given the creation of SMARTY goals by the Faith-Based Outreach Initiative. For new members, we also held a Bronx Health REACH and Not 62 training. This fall, our focus was on getting out the Bronx vote, and our efforts were largely informed by our various presenters, including Roberta Todd from Northwest Bronx Community and Clergy Coalition, Daniel Garcia McGuire from NYC Votes, and Bjarni Burke and Cleveland E. Beckett from the NAACP. Leonardo Mendoza from Congressman Richie Torres' office joined us in September to review some areas that the congressman is focusing on and provided updates. And in October, I attended the Robert Wood Johnson Foundation Culture of Health Prize alumni lunch with other Not 62 steering committee members, Liz Burrell-Huss from Montefiore and Dr. Bola from the NYC Department of Health. And this is depicted in the bottom right photo of the slide. And in the bottom left photo of the slide is me presenting at the Institute for Family Health Research Symposium on the work of the Not 62 campaign. And I will now pass it over to Charmaine.
Thank you, Eve. So, Michael, next slide. I think. The Not 62 campaign, the steering committee of which Bronx Health REACH is a founding member, has continued meeting in 2024. We've been paying particular attention to 2 areas. Nutrition, particular, the policy, what sort of policy effort we should be mounting. And one of the areas we have landed on, or an area that we have landed on, is around codifying health bugs. Health bugs is something that, for those who may not know, got its start here in the Bronx. The then known Bronx District Public Health Office launched the Health Bucks effort several years ago. As you heard Immaculata present, Bronx Health REACH has been a big part of that. And the Not 62 Steering Committee, understanding the impact of Health Bucks in increasing access to healthy food in the farmers market, wants to make sure that this is sustained in a real way. Right now, we are happy to know that Health Bucks is funded by the City Council, but it is not a standing budget item for this in the city budget. It is there. City Council supplies funding to the health department to administer it, and actually, I think 10 years ago, then City Council member Richie Torres was the first City Council member to put funding from his discretionary funds to support Health Bucks. We've seen many City Council members do that since, including our current borough president when she was City Council member. That notwithstanding, the Not 62 Steering Committee, in particular, its food subcommittee, is exploring the possibility of how can we codify that so it is a standing funding line in our city budget. The other area that the steering committee focused on this year was mental health. We also had conversations with the Robert Wood Johnson folks on the 2024 report that they put out. We were particularly happy to have them come and talk to us, particularly in the area of the fact that they have in this year's report and last year's report, they place particular emphasis on civic engagement, political determinants of health. And given the big year this was in terms of elections, we wanted to understand why they put so much emphasis and what lessons we can learn and glean from that. So that's the work that the Not 62 Steering Committee has been doing, led by Dr. Bola from the Health Department. Next, we're going to go to Immaculata, talking about racism in our family's health.
Thank you, Charmaine. Our racism in our family's health, connecting the dots, is a faith-based led effort with the goal of understanding how racism is making us sick, and highlights the work of our Bronx houses of worship addressing this. We worked with Dr. Ball to bring in experts pictured here. He was really a great asset in bringing, or a great resource to bring in experts and resources and materials to better understand the problems being addressed by our health disparity work group. Together, we developed goals focused on the #Not62 campaign for a healthy Bronx. One strategy Dr. Ball used was a pastoral circle, which requires oneself to observe, judge, and act on reality from the perspective of faith. Here you will see our top priorities that the group identified. And these are health education and awareness, focused on healthy eating and creating healthy habits, housing affordability, no more than 30% of their income, and third, engaging youth towards healthy living and decision-making through community service. I also worked with our amazing staff and a consultant on our Immigrant Health Initiative. The Immigrant Health Initiative focuses on decreasing health disparities among foreign-born New Yorkers, regardless of their immigration status, by focusing on 3 goals: promoting access to healthcare, dismantling cultural and language barriers to need healthcare, and increasing access to resources and intervention. Our outreach group provides necessary resources and information for undocumented immigrants for the access that I mentioned before, and also preventative care, health insurance, and pro bono legal consultation as needed, which services are offered by the Institute for Family Health, New York Lawyers for the Public Interest, and Public Health Solution. Our Bronx Health REACH community outreach team, pictured here, with Joseph Ellis, Sheku An, and Felix Roja, have completed 73 outreach events and made 130 patient referrals. They've also participated in 6 podcasts. I'll pass it on to Joseph.
Joseph, are you there? Joseph, are you there? You're on, Joseph. You're on mute, by the way.
Sorry about that. Yes, Men Let's Talk. October 24 marked 2 years of Men Let's Talk, a forum for Black and Latino men to engage in open and honest discussions about concerns on their mental and or sexual well-being. Men Let's Talk had been funded by the New York State Department of Health through the Minority Male Wellness Initiative. In February 2023, when the funding ended, Bronx Health REACH made the decision to continue the monthly Men Let's Talk meetings. To date, 323 people have participated in discussions on several topics, including men and intimate relationships, mental health awareness and substance abuse, and men and conflict resolutions. Pass it on. There we are.
We actually have the CEC grant. We don't have a slide for it, but we'd like to hear about it though from Kenny.
Yes, so the CEC grant. So Bronx Health REACH was awarded the New York City Civil Engagement Commission, the People's Money Grant, to slash Bronx hunger and boost their knowledge about healthy eating. Therefore, we'll be increasing access and knowledge of healthy foods in the Highbridge, Concourse, and Mount Eden neighborhoods.
Okay. And Charmaine, you wanted to share about the Flash grant as well? You're on mute, Charmaine.
It's a New York SEAL funding that has allowed us to launch 2 new initiatives this year, Flash and BRC, Building Resilient Communities. Immaculata, do you want to speak a little bit about the Flash initiative?
Sure. We received funding from the National Institutes of Health for 2 initiatives, like Charmaine said. The FLASH initiative stands for the Food for Living, Access to Systems, and Supportive Strategy for Health Equity. And Building Community Resiliency is the BCR component. So the 3-year NIH Flash grant focuses on improving health and wellness for residents of the Morrisania neighborhood by improving physical and food environment, starting from like community gardens, offering affordable local food option, enhancing the social environment, encouraging people to connect and stay active through walking groups, and building community skills for healthier lifestyles, teaching simple, culturally relevant activities to improve health. We have 3 sites that we're working with in this Morrisania neighborhood. Manna of Life Ministries, New Covenant Development Corporation, and Reconciliations Families in Christ are the 3 partners that we will be working with the FLASH initiative.
Thank you.
All right.
I'm sorry, before you go ahead. Thank you, Immaculata. The Building Community Resilience effort that's funded, and just one point of clarification. I had said New York SEAL, you heard Immaculata said NIH. It's an NIH-funded initiative to the New York SEAL effort, of which the Institute and Bronx Health REACH is one of the funded recipients. So the Building Community Resilience, as you may have noticed throughout many parts of this presentation, we have been talking about the amazing work of our community outreach workers. And in two of these pictures, the two to your right that you're looking at right now on the screen are the community health workers, and the Building Community Resilience has provided us an opportunity to take care of and pay particular attention to our community outreach team, who they are paying attention to the community, doing the outreach to the community, providing opportunities to inform the community, hearing from the community in terms of health issues, trauma that the community may be experiencing that we need to address. But the question is, who is taking care of the outreach team? So the Building Community Resilience will allow us to do that, allow us to sort of look inwardly, if you will, and say to our community outreach team, how can we help you as you are on the front line of so much of the work that we're doing in our community engagement? So we're looking forward to come January 2025, when there'll be trainings done with our community outreach team, trainings about how they protect themselves, and how those of us who either manage a team, provide direction for the team, how we're making sure that we are also paying attention to them and taking care of them. So that's the Building Community Resilience part of this funded effort. Michael?
Great. All right. Thank you, Charmaine. Good morning, everybody. My name is Mike Johnson. I'm the Communications Associate here at Bronx Health REACH. So the slide you're looking at now, in May, Bronx Health REACH showcased projects at the Institute for Family Health's 12th Annual Research and Innovation Symposium. This was held at the New York Academy of Medicine. That would be the 3 slides, the 2 top and the 1 on the left. And the presentation, the first one, that's Kenny Escobar. And the poster that they had was, was Food is Medicine, designing and implementing a produce prescription program at federally qualified health centers. The one right below that is with Mariah, and that is doula and perinatal care navigators' impact on COVID-19 and flu vaccine decision-making in Bronx pregnant and breastfeeding women. The upper right one is Immaculata Maranta with Immigrant Health Initiative, efforts to support underserved immigrant groups by improving their access to healthcare. And it was in a previous slide, it was under the Health Disparities Work Group. It was Eve Plotka, and I just stepped over it here. Creation of a Movement. The poster was Creation of a Movement, Not 62 Campaign for a Healthier Bronx. And then finally on the photo on the bottom right side, in October, Sheku Omar Ann, Felix Rojas, and Joseph Ellis. They are the community health workers with the Institute for Family Health's Bronx Health REACH. They were recognized at a ceremony hosted by the New York City Department of Health and Mental Hygiene for the amazing outreach work they do with men in the community. The award was for their outstanding work during the New York City Department of Health and Mental Health's Harlem Family Wellness Suite Day for Dads event in June, and their leadership of the Men Let's Talk initiative.
Thank you, Michael.
Thank you, Charmaine.
So As I mentioned in my opening remarks, we, the staff of Bronx Health REACH, could never in a million years do all that we do. It's all about the coalition that we have and our partners. So without our partners, as I said, none of this would be possible. And so a huge thank you to all our partners that have made the year in review that you just saw, have done the work, have the funders, the ones who, through their funding, staff gets paid, partners through subcontracts get funded for the work that they're doing. And so here's a list of partners. The CDC, of course, that it's through their REACH funding beginning in 1999 that led to the launch of Bronx Health REACH and has continued to fund us. We just started the second year of the new 5-year grant that we got last year. In addition to funding our work around making healthy eating as accessible and possible, and creating the kind of infrastructure that you heard described that will allow for increased physical activity. They also fund our flu and COVID vaccine initiative. You heard Mariah speak about the HRSA funding that supported our COVID vaccine initiative as well. The New York State Department of Health has been a longtime funder of Bronx Health REACH, first through school wellness, now through the Creating Healthy Schools and Communities initiative, and an initiative that was for a short time, 2 or 3 years, the BRIC initiative, Building Resilient and Inclusive Communities. We have been the fortunate recipient of funding for 2, maybe 3 years from the New York State Division of Criminal Justice Services. An interesting point about this is that this is not a funding we have ever applied for. We just get a notice that in the state budget for this division, there is a line for Bronx Health REACH under juvenile justice. And it has been a head scratcher for me why we have received this funding. Other than that notification, nobody has ever come out and said why this funding has been placed for Bronx Health REACH. But I think about a year ago, I was putting together a presentation on work that we had done with a partner, Casita Maria, to establish in partnership with some NYCHA housing, doing some murals. And when Casita Maria did their presentation on the impact of the murals, one of the things they highlighted was the fact that one particular mural was painted on a wall in a park that had recently been known for its illegal drug activities. But with the painting of that mural, an area that had significant gang activity remained untagged. And Casita Maria presented that it was deemed a gang-free zone where the community could go in, enjoy the amenities of that park. So a park that had been padlocked for some time was now opened. And I suspect that somebody from New York State Division of Criminal Justice Services heard the telling or retelling of that particular impact and putting a little funding in the budget for this. And so this year you heard Diana talk about the work at CS 300 that was funded through this. New York City Department of Health and Mental Hygiene has been a funder. New York Health Foundation, you heard Kelly talk about the funding we received from them for a new bodega initiative, the New York City Council for Immigrant Health, as well as the Health Bucks effort. You heard Kenny present on a new effort that's funded by the New York City Engagement Commission. Several of you may know of the participatory, but made it as many years ago. I was gratified to hear somebody say that this is not a coalition on paper, but a real coalition, and it's the partnership and the allies that make it a real partnership. And you saw that work laid out in our year in review. We also have to thank Institute of Health funding to New York SEAL. We did not directly receive it, but a partner, Corbin Hill, received the Gus Schumacher Nutrition Incentive Program that has supported our Food as Medicine initiative. And a few years ago, we were very fortunate to get the gift of funding from the Silicon Valley Foundation. That has, since we received that funding, allowed Bronx Health REACH to be able to do several of our efforts that cuts to our CDC grant would have otherwise presented. So much thanks to the funders for what they have made possible over these last 25 years.